The invertebrates, well, let's look at that word. There's a word vertebrate in there, backbone. In means without. So these are creatures without backbones. Platyhelminthes, platy means flat. If you ever had a dog that had a worm infection, you might give him a anti-helminth. So helminth means worm. Well, the worm body shape is one of those successful designs of nature. There's lots of different worms, not just what we see in the soil. For example, the flukes. This is a type of platyhelminthes. Okay, so this is a group. The platyhelminthes is a huge group with different types, flukes being one of them. They have suckers for attachment, and if you look at this example, you see near the anterior end, nice sucker there, for attaching to the internal organs, usually the colon. Famous blood flukes, Schistosoma mansoni, causes schistosomiasis. Now we don't hear about this much where we live, but in many tropical places around the world, man, schistosomiasis is huge. Where there's human sewage, warm water, we have blood flukes. Here's a good example of the life cycle. The young flukes develop in snails. Let's go down to snails. So snails are an intermediate host. If you can get rid of the snails, then you can get rid of these worms. The flukes will emerge. They'll bore a hole right out of the snail. And when I lived in Africa, we just wouldn't go bathing if we saw any snails that had holes in their shell, because we go, okay, we'll have to go somewhere else to clean up. They're going to swim and burrow into the skin, and you get a little rash, sometimes called swimmer's itch, and that's a sign that they've penetrated your skin. It's usually not fatal, but it lowers your infection, your immunity. Tapeworms, another member of the platyhelminthes, the flatworms. They have a head-like region called the scolex. And I look at this. I saw X-Files once. They had a giant tapeworm. But you know, this is not really a head. There's no brain, and there's no eyes. These look like eyes, but these are suckers, and there's the hooks on top for attachment. Not a pretty sight. The reproductive segments are called proglottids, and again, if you've had a pet and you see these little white, these will break apart, these little proglottids. There'll be little flecks of white in the stools. Then you know your dog's got a tapeworm, right? Humans get them too, of course, if from beef, but usually it's detected in the slaughterhouse, so we can eat our steaks rare. Symptoms, pretty mild, weight loss, but a large clump of them can block the digestive systems and become serious. Nematodes, these are a different group of worms. The roundworms, they're called. They have a tough outer cuticle, and you'll see why this is important. Pinworms are really, the technical name is enterobius, and they'll cause enterobiasis, pinworm infection. It's one of the most common worm infections of developed countries. They're about the length of a staple, and if you'll see this, we ingest it, and sometimes these darn eggs are so small they're airborne. You can inhale them, and then the adults live in the rectum, lower part of the colon. The life cycle, usually, I don't know why they do this, but at night your peristalsis slows down, your body quiets, and the females will crawl to the perianal. Peri means around, so around the anus, and they'll lay their eggs. And these darn eggs itch, and so the host is going to scratch, and that's one of the symptoms is a itchy anus. Now sometimes if children don't wipe properly, they itch too. So you can't, just because the kid's scratching doesn't mean he or she's got pinworms. But you can use sticky tape at bedtime. You got to explain to the child what is going on, so that we don't have any question about that. Or you can use gloves and do a middle of the night examination with a flashlight. Again, you get to explain it very thoroughly and tell someone else what you're doing. Okay. Here is a type of nematode that's not very friendly. It's trichinella, causes trichinosis. Now people get this. I've had several students over the years where they've had a parent or uncle, a relative get trichinosis. Usually someone works as a butcher or works around meat a lot. And the problem is with pigs. See, the nerve cell trichinella larvae are so tiny that they're not detected in the slaughterhouse very easily. And that's why we have to assume anytime we eat pork, that's infected. You know, I always get a paper bag, and I try not to work with pork. You know, either I'm going to throw it in the skillet the way it is, or yeah, I just don't want to handle it. Be careful with raw pork. In our country, it's safe. Our swine industry is very thorough, so it generally is when you're overseas in a developing country. Here's the life cycle, and you'll see why it's not such a friendly worm. The newborn larva is going to break out of its cyst, travel into the bloodstream, and it starts to puncture organs. Sometimes it ends up in the brain. So unlike the flukes and the tapeworms that just stay in the colon, these guys will move throughout the body and cause serious bleeding and sometimes death. They'll move into the brain, out through the nasal cavity. Oh, a terrible disease. I've seen some of it, but mostly with wildlife, not many in humans. Filariasis, or elephantiasis, better known as, mosquitoes are vectors for the Wucheria nematode. Now, mosquito bites are serious. In 2016, we have an outbreak of organisms vectored by mosquitoes. So one of the best things you can do is always protect yourself from mosquito bites. Wucheria, the nematode is going to go into the lymph systems, in the axillary regions, the armpits, sometimes the groin, and it's going to block the draining of lymph. Now, a lot of people don't realize this. We know about the bloodstream, but parallel to the bloodstream is a lymphatic system that is sort of recycling and purifying our fluids. But if you block it up, now we have a swelling called lymphedema, and that's the telltale mark of elephantiasis. Mostly a third world or underdeveloped country disease, and it's treatable, but some people they're more effective beggars if they have those lymphedemic growths. Annelids, these that means little ring. There's lots of annelids. We think of the earthworm, but the leeches are pretty famous. They produce an anticoagulant called hyaridin, which prevents blood clotting, and we can use them, like if a finger's cut off, we can reattach it because we want to prevent blood clotting, and hyaridin does it well. Some people still keep leeches, some hospitals. It seems to work better than an injection because it's a slow infusion of hyaridin. Arthropods. Arthro, think of joint, and then pod means foot, so these are the jointed foot creatures with exoskeletons that are for support and protection. Now, it works well when they're small, but if there was a giant spider the size of a car, it couldn't move because the way the physics of the exoskeleton. One group, chelicerates, the spiders. They have chelicerae, that's what their name comes from, fangs. All true spiders have fangs. Of course, daddy longlegs don't have fangs. They're not true spiders. Pretty harmless for the most part. Two body regions, the cephalothorax, which is the head and thorax, and the abdomen, which is sort of the reproductive and digestive part of the body. Oh, hey, there's Carlos. Huge spider. I know you can't see very well down in Costa Rica. Araña grande, you would say. Ooh. But you know, most spiders are really beneficial. Very few they're harmful. Here are two. If you know these two, then everything else is safe, really, in North America. As I said, they're beneficial, but these guys not so good. Black widow injects a neurotoxin, affects the central nervous system, CNS. This is the adult, but you know the immatures have a spiral and kind of brownish shape. The bite is not that serious for an adult. I get a backache when I get bitten. I get a backache and a little bit of a headache, and I just kind of take it easy. And sometimes I get just near a hospital just in case, but it's mostly a problem for elderly and very small children because it's such a tiny dose. People kind of freak out about these girls, excuse me. Okay, brown recluse injects a digestive protein, and this one again, the venom's not that much of a problem, but it digests a little hole in our skin And then the bacteria come in there, Staphylococcus, and it's the bacteria that cause most of the damage, not really the venom of the spider. They're sometimes called fiddleback spiders because they have a little fiddle shape on the cephalothorax there. Very rare though. Acarines, these are ticks and chiggers. They can inject a spirochete. Maybe you've heard of Lyme disease. It's sometimes a bullseye rash, but I think it's less than 50%. So sometimes you can't always count on the bullseye rash. Easily treated with doxycycline, but if not treated early, we have joint inflammation, paralysis, and a chronic disease. Insects are a group of arthropods. So these are all exoskeletons. We think of dengue fever caused by the flavivirus. Okay, so here the virus, it's very strange. There's the name. It's sometimes called backbreak fever, and that's because look at the symptoms: high fever and sharp pains in joints and muscles. Extremely painful. Here's the weird thing it does. The flavivirus is studied with these E proteins that are going to attach to our own cells, and such as monocytes. Those are a type of white blood cells. And then it kind of overwhelms our body defenses. So here's our cell, and there's the flavivirus attaching. So very clever virus. Okay, I mentioned vertebrate. That word, it means backbone. Bony vertebrae surround the spinal cord, so thank goodness. And here are the regions. We have the cervical, which is the neck, thoracic, lumbar, sacrum, and the coccyx, or the tailbone. All right, so those are the 5 main regions of our vertebra. And these are attachments. If you wonder why they're so knobby, these were lots of muscles attached. Okay. Cranial bones, pretty cool. We need these cranial bones because when we're born, those fontanelle plates are going to slide past each other, making birthing a little easier for the mom. So these are actually joints. They become fused as we age. So the parietal here, frontal, good name for that. Temporal, right near the temples. Sphenoid, which is a complex bone with these wing-like structures. Ethmoids inside, and then the occipital, think of the back of the skull. Hair, we think of lots of things being hairy, like flies and bees, but vertebrates have, some vertebrates have true body hair with a cuticle, a keratin protein, and a medulla where the pigments are. Okay, so our hairs are really quite sophisticated here. The papilla is an indentation where the blood down in the bottom here and keeps it alive. The focus is lined by a periodontal ligament that attaches the cementum on the surface of the root. So take a look at this tooth, typical root. It has an apical foramen through which blood vessels and nerves pass. So here's the apical. Apical kind of means tip. Well, vertebrates are disappearing, and habitat loss is the main reason. Okay, we're humans, we're just taking over the world. And so one of the ways we can protect wildlife is through economic incentives. And so we try to sustain vertebrates by making it profitable to preserve their habitat. For example, sea turtles, we can harvest sea turtle eggs. And I worked in a community in Costa Rica, and so they used to just kill the sea turtles for food. Now they harvest the eggs, and they leave some eggs there. And the same thing is done in Africa. The skins and the meat are sold. So sometimes we have to make something valuable to make it worth saving. It's kind of crazy, but we have to work with the humans. We have to work with each other. Okay.